Hello, I'm Dr. Ariana Hoet. I am Clinical Director of On Our Sleeves, and today we're here with Coach Ryan Day. He is the head football coach of the Ohio State Buckeyes. Thank you for being here with us.
Great to be here.
So we are going to be talking a lot today about children's mental health, especially as it relates to sports and what parents can do to support their children, their little young athletes. But before we jump in, I'd love to hear from you a little bit, just your story and your experiences, what shaped you and made you such a strong advocate for mental health.
Yeah, I grew up in New Hampshire and was involved with sports my whole life. I lost my dad when I was 9 to suicide, and then kind of growing up in this world, it was a challenge at times, just as a young person trying to figure out how to handle all of those emotions, but also just to see what happened to my dad. And I often think about, if he had gone through what he had gone through at that time, in this time period, if things would be different. And so everything kind of came together here in Columbus, which was really at the forefront of mental health advocacy, and certainly with children. And kind of going through that tragedy as a youngster is made me want to try to help.
Yeah, speak about it and destigmatize it for other children in that discussion.
Yeah. Well, that's really what it is, because certainly back then nobody really talked about it, and certainly our family went through our challenges with that, and even today, I think a lot of people still think that there is a stigma attached towards asking for help in this mental health arena, and I think that we're doing a really good job of trying to break down those stigmas.
Mm-hmm. Absolutely. And I think with children's mental health, as a psychologist, I often hear kids don't feel stress or sadness, and so being able to highlight, yes, they do, and we can talk about it.
Well, yeah, and I think we all have done a pretty good job of talking about physical health, nutrition, and I think our youth does a pretty good job of understanding how to take care of themselves physically. But how do you take care of yourself mentally? And I'm not sure many of them can verbalize that, but I think that we're trying to give them the tools and the resources to be able to do that.
Absolutely. So now you're a dad, and I'm sure you've noticed that kids do have those range of emotions, but they don't always talk about them. Right. What works for you? How do you check in with your own kids?
Well, we first off, we try to talk about it and normalize the conversation the best we can, because certainly with the job that I have and dealing with 19, 20-year-old young men and seeing the challenges that they face with stress and different things and anxiety, but then also taking it back to the home and making sure that you're providing the resources for your family and talking about those types of things. But really, I think when the children feel comfortable talking about, hey, I may need a little bit of help right here, but then also providing the therapy or the resources or the appointments that they may need to work with people. And we all have mental health, and we're all responsible for our mental health. And so sometimes it's preventative, sometimes it's a reaction to something that's gone on in the past. But I think, again, making sure that we have the conversations and talk about it openly is something that's healthy.
Absolutely. And you mentioned, as a coach, you work with 19, early 20-year-olds. That, I feel like, especially in young males, is one of those groups where mental health is a highly stigmatized topic. What has worked for you with your team to create a space where they do come to you and they do talk to you about it?
Well, I think it's an area that you can't, really slam it down their throats. I think first off, you try to lead by example. You show them that these are some things that have gone on in our lives, and try to be vulnerable and show those, show our players that it's okay to ask for help. I've asked for help, in different struggles that we've been through in our family. But then also just to provide, the resources they need here, and to know that they're supported and that they can come in and sit on our couch. And I can tell you how many tears have been on that couch right there, just sharing their stories of what's happened to them. And almost to a person, after they've gone through and they've talked to somebody, they always feel better.
Right.
They always feel better. I think it's just providing the environment where it's safe to ask for help.
We know that the earlier we start talking about it, the earlier we start being aware of mental health, the better, the more normalized. So what do you say to the parents of young athletes, elementary, middle school? What should they be doing?
Well, I think it's a great question, and I think it's a sensitive question, because I think everyone knows their own children. And I think that at the end of the day, we're giving them the tools, and we're building the resilience that they need to go battle some of these things that are coming, because they're coming. Adversity's coming, tough times are coming, struggles are coming. And so are these tools and resources going to be in place for them to deal with them when they come? I don't know what's right for every family, but I can tell you that, when you know your children, you know when it's right. But the only thing you can't do is just not have these conversations. Think that they're just going to go away, and think that just because, if I say the word suicide, or I say self-harm, or if I say some of these words, that all of a sudden it's going to trigger your children. And that for sure is not the case. But everyone knows their own children, and you have to handle it the best way. But being open, I think, is very important.
I agree. We're just getting started.
That's right.
On our sleeves. Well, thank you so much for having this conversation with us today.
Absolutely.
And hopefully we can keep talking.
All right, sounds good.